Hi, I'm Dr. Patrice Harris, a psychiatrist and Everyday Health's Chief Health and Medical Editor. I'm joined today by Dr. Tamika Cross, an OB-GYN in Pearland, Texas. We've selected Dr. Cross as one of the health change makers for our Black Health Facts MLK Day and Black History Month feature for her work providing affordable, accessible care to underserved communities and to women of color, where I think we all know culturally competent care is not always available. So I'll hand it over to Dr. Cross to further introduce herself.
Thank you, Dr. Harris, for the warm introduction. Yes, my name is Dr. Tamika Cross, and I am a board-certified obstetrician and gynecologist practicing in the greater Houston area, specifically in a suburb called Pearland. Pearland is about 15 miles south of Houston. It's a pretty diverse area of Houston that has pretty much every different type of ethnicity. I also have a practice there, Serenity Women's Health and Med Spa, that we opened not too long ago in the middle of the pandemic. And so we're able to provide that affordable, compassionate healthcare to women in the area.
Well, I definitely want to hear more of that amazing story, opening up in a pandemic. But first, tell me a little bit more about you. Did you grow up in a diverse community, or was your experience similar to mine? I was born and raised in West Virginia. And although my particular community was diverse, certainly communities of color made up a small proportion of the community. So tell me a little bit about you and where you grew up.
Yeah, absolutely. So I'm originally from Detroit, Michigan. And so Detroit is definitely a predominantly Black city, African-American city. However, we did move out to the outskirts, to the suburbs when I was in elementary school. And so it was more diverse at that time in the early 90s. But over time, it has become an area of more minorities. So I would say for most of my education and most of my years growing up, I was in an area where I was around more minorities, where I wasn't really the minority.
And was your experiencing growing up a part of what led you to first, of course, become a physician, but then to specialize in obstetrics and gynecology? And if not, what inspired you?
Yes, absolutely. So although it was a diverse area that I grew up in initially when I was younger, and then it became predominantly African-American, what I didn't see a lot of was African-American physicians. I did have an African-American pediatrician and dentist growing up, and so in my younger years. And so that was very, warming, especially to a young aspiring physician. But it did definitely lead me to want to be the change I wanted to see, essentially, especially coming from a city where I saw many Black professionals, but not necessarily as many in the healthcare field.
That was a little bit different than mine. I did not meet a woman, African-American physician, to after my undergraduate years. So it sounds like you had a mix of some African-American professionals, but not as many in the medical field. So tell me how long you've been practicing and how has your practice evolved since leaving residency?
Yeah, so I've been practicing independently for going on 5 years out of residency. And it's definitely evolved quite a bit because I was in academics originally, where I was working in the same academic program where I did my residency at the University of Texas. And then I moved over to private practice. And so that was definitely a different experience. And so what I was able to see at that time was going from working in the county hospital. We actually had privileges at multiple hospitals. So I was able to work at the county hospital with uninsured patients here in Houston, Texas. So we have a lot of patients that, are immigrants as well. And so I was able to take care of those patients that needed care and hadn't seen doctors in years, but then also able to take care of patients in other facilities where they may have more access to care. So kind of getting exposure to both sides, I think kind of really helped to build me up as a physician to be a little bit more well-rounded in that approach.
You know, I think we share that experience. A lot of folks share that experience in residency, where we certainly are able to take care of patients who may have more access, may have insurance, but also we take care of patients who are either uninsured or underinsured. And I always talk about the privilege of being a physician and the fact that we have front row seats to what's working in healthcare, but also what's not working. And clearly the health inequities and issues surrounding the health inequities are not working. And we've had the privilege of seeing both sides, and certainly there are many sides in between, if you will. So you were lauded early on in your career, receiving the United States Congressional Recognition for Community Outreach and being nominated as one of Becker's Hospital Review's top 60 most powerful people in healthcare in 2016. I remember that because I interviewed you then. Can you share the work you did to receive that recognition? I know about it, but the world needs to know about it.
Yeah, I did a lot of different things at that time. I was actually still in residency, finishing up my residency at that time in OB-GYN. And some of what I was doing was working with like surgical site infection task force and trying to reduce infections and things like that in the county hospital system. Also working for different task forces with the hospitals to be able to reduce maternal mortality rates as well. In addition to, I was in the news for, an incident that happened on a plane where I wasn't allowed to, render aid to an unresponsive passenger, and because they didn't think that I fit the description of what they thought a doctor looked like. And so from that, I used that situation that we've all probably faced at some point in our career to really not let it die down and continue to talk about it and start a national, well, really international conversation at that time about bias in healthcare, and continued going coast to coast talking about bias in medicine and in the workplace, and how we can, what we can do to overcome our own bias and how it affects patient care. So that was some of the things that I was doing back then, and still to this day.
Absolutely. And I want to personally thank you for that work. And when I interviewed you back in 2016, we were talking about that, because it is easy to forget after a particular incident, the stimulus for an incident. And I just applaud you for continuing to elevate these issues around bias.